On this episode's intro with Grandma Bellitti, I asked if contraceptives were a thing when she was growing up. What about contraceptives or birth control? Did any of that kind of stuff exist back then?
Well, no, not really.
No?
No, we didn't have any of that stuff.
Like no medication, but condoms, I would assume, right?
Well, that's about it, yeah.
Yeah.
That's about it, condom. They had that stuff.
Was that hard to buy at the store? Because it was, it's awkward even
Well,
now, but was it awkward back then? Because if it was a taboo topic, I'm sure it's
I never had
No.
yeah.
Me neither.
And none of that had none of that stuff.
Welcome back to another episode of Behind the Counter. On this episode, we have Lina, who's one of our pharmacists here at HB Pharmacy, and we're going to talk about birth control. Mm-hmm. Now, we unfortunately didn't have a good example to be asking these questions to Lina, so I will be asking some of these questions because these are common questions that we get a lot at the pharmacy. Mm-hmm. And for all of my friends out there who are going to say, oh, yes, Vince is basically a little girl anyway, so it's not a big deal. Thank you. That was hurtful.
Not wrong, though.
Right.
Not wrong.
Thank you very much. That was hurtful. See, I knew I was going to get that. Anyway, so I think from my perspective and from the perspective of a lot of our patients too, we kind of, or not we, people take birth control without really, right, exactly. People take birth control without really thinking about it. Mm-hmm. It's almost like you take a multivitamin or you take something else, when truthfully, it's really hormones that you're putting into your body. It's a lot more serious, or there's a lot more to consider when it comes to taking birth control that we kind of just, forget about it. Oh, whatever. It's just what you do.
Exactly.
Right? Mm-hmm. So I guess what are, starting off with what we hear at the counter, I mean, is it, like I just said, it's a hormone, right? So is it safe to take? What's your perspective as a pharmacist on that?
So in one word, it is safe. As long as it's taken the right way, it is generally safe. A lot of the misconception or preconception more so about birth control is based on the estrogen part of it.
Okay.
I've heard people who are worried that, what if, I heard so many bad things about estrogen, mm-hmm. What if it causes cancer? What if it causes blood clots and then causes me there to be a stroke or something? That actually is a valid concern, and there's a reason for it. However, the formulations that are out there, the types of birth controls that are out there, typically now has a very, very, very low estrogen compared to almost minimal compared to, say, for example, both birth controls from like 10 years ago when they actually found out that that estrogen had all these side effects.
Sure.
So, generally speaking, the combination pills that contain estrogen out there are safe, safe to take as long as they're taken the right way.
And what is the right way? Consistently,
during the same time. But that's not to sort of disregard the adverse effects of it. Therefore, there is another formulation of birth control specifically for patients who are at high risk of developing these adverse events. These are not usually common, but they are referred to as the mini pills, and they only contain progesterone. However, again, it's very limited to patients who are at high risk, such as patients who are breastfeeding or who are women of 35 years and older who are smoking, or people who have history of migraines with aura. But again, upon consultation with your doctor, they should be able to.
So speaking of migraines, I've heard of that as a possible side effect of birth control. I've heard of acne and things like that. What are some possible side effects, even if they're more minor ones, and what should you do about it if you feel like you're experiencing some of these side effects?
Yeah. So as we said before, these are medications.
Right.
So unfortunately, with a lot of medications, they do come with side effects. I would like to say that they're generally very mild. And again, these come from the fact that these are external hormones coming into your body and your body's sort of adjusting to it. So some of the most common side effects are sort of mood swings, bloating. Some people experience weight gains. A lot of commonly experienced side effects are also something called spotting.
Okay.
In that case, usually the recommendations are to continue it. Again, as I said, it's your body getting adjusted to the external hormones that are coming into your body. So generally, we do recommend continuing with the same formulation that you were given or that you were started for about 3 months. And then if these symptoms, by that time, these symptoms generally they stop.
Okay.
After the 3 month period. However, if you're still experiencing the same symptoms after the 3 month period, then that would be the time where you contact your prescriber or even talk to the pharmacist about it and see what kind of other formulations, because there are a lot of types of birth controls out there.
And there are other types of birth controls that are not oral contraceptives as well, too. So, I mean, that's not really a topic for this video, but if you have questions about those too, obviously talk to your healthcare provider or ask one of us as well, too. So we hear this a lot in the pharmacy, but is there a difference between the brand and generic when it comes to birth control specifically?
Fair question. We actually do get that a lot. Some patients do swear by certain brands, but with all the other medications, just like all the other medications, essentially the brand and generic, they contain the same active ingredients, which is the type of estrogen and the type of progesterone that are in the product. So at the end of the day, it is the same medications that are active. They do have different inactive, or they may have different inactive ingredients. But when it comes down to the active ingredient that brings in the effect, or the effect of the medication itself, there is no difference. I guess the only difference would be that or the only advantage that certain brand medications would have versus generic medications is that certain manufacturers do offer coupons, manufacturer coupons, so they may bring down the copay.
Sure. That's a good tip. And I guess whatever's covered too.
Exactly,
right?
Whatever's covered.
Yeah.
But all in all, brand, generic, they're the same medication.
Okay. So how about this then? Another common question I've heard. For whatever the reason, maybe out with friends or maybe just forgot traveling, didn't bring the medicine. I missed a couple doses. What do I do?
That also depends on the formulation.
Okay.
Generally speaking, rule of thumb is progestin only pills. So the mini pills that I talked to you about earlier, those have to be followed more strictly. Okay. So if you've missed your dose within the 3-hour frame, generally speaking, for the next 72 hours or so, say for example, 3 to 5 days, then you would need a backup. When it comes to the combination pills, which are the most common ones, it gets a little tricky. It really depends on how many you missed or during what cycle you missed. So the best answer and the most accurate answer that I could give you is to look at the package insert or the information that's written on each of the individual medications, because each of the formulations, certain formulations, there are different formulations where it follows more of a rhythmical cycle.
Okay.
So that it's different from, say, for example, like a monophasic birth control, where it's just same amount of hormones throughout the cycle. So best advice is read your medication. If you have questions, then call your pharmacy or call us. We'll be able to even read it for you and then direct you.
Cool. How about birth control and Plan B? Is there a difference? I mean, obviously, I know Plan B doesn't really require a prescription, even though it does require a consultation with the pharmacist at least, right? Mm-hmm. So what's the difference, and is there a difference?
There is. Obviously, there's a reason that, one's prescription only and one's over the counter. Plan B actually contains only progesterone, but a lot higher dose of the progesterone than what we call the birth control pills. The difference is, I guess, is that birth controls are regular medications that you're to take daily, ideally the same time, every single day to prevent pregnancy. Emergency control contraceptives, such as Plan B, are more so, as the name suggests, for emergencies, you know. And I really want to emphasize that with these emergency control contraceptives, although there isn't a set regulation or a set amount of pills that you may take in a certain amount of time. There is no limit, quite honestly. But it is not recommended that you take it, say, for example, every other day, or basically as your main method of birth control.
Right. Cool.
And
is there anything else you want to add about birth control in general? Any other questions you could think of? I know from a nutritional perspective, we learn more about nutrient depletion and medication and that kind of stuff. And I know from a nutritional perspective, B vitamins can be depleted by birth control.
Exactly,
so we end up
which
recommending
actually
that
ties into the conversation that we had earlier about mood swings, where, you know, feeling fatigue. A lot of the times, as I mentioned before, birth controls have been generally identified as like a safe medication to take long term. But studies have shown that there was one thing that was noticed in patients who are constantly or chronically taking birth controls, which is nutritional depletion.
Right.
So what they found out is people who have been constantly on birth controls are low on folic acids, vitamin B, as you said, and magnesium, such and such and such, that are essentially needed for us to be feeling better, or
just function on
a daily basis.
Yeah.
So really, for people who are having a difficult time with these birth control, instead of, you know, stopping it or trying to change the formulation to a different formulation, that may be a problem solver. But in some cases, we have noticed that supplementation, nutritional supplementations, especially vitamin B complex, could be a solution to that as well.
Cool.
So I'm glad you brought that up.
Yeah, for sure. Cool. And any questions, as always, you can find more information about us at hbpharmacy.com or gasparsbest.com. Thanks for joining us, Lina. That was very informative.
Thank you.
And we'll see you guys next time. Thanks.
Bye-bye.
We're talking about a couple specifics now to add some of the nutritional side of things, right? We hear a lot about certain plants, especially here, oysters or some of those kind of things, like that's an aphrodisiac, or pumpkin seeds, I hear, or even like you mentioned, arginine, or they'll have the NO supplements that are supposed to be better than the arginine because it's, you know, already in the NO that your body can access.